Hello, you're watching Introduction to Integrated Health Partnerships, known as IHPs. This is the state of Minnesota's short video about the basics of IHPs. By the end of this video, whether you are completely new to IHPs or are a seasoned participant, you should come away with a better understanding of the following. 1. What is an IHP? 2. What are the goals of the IHP? 3. What are the different types of IHPs? And 4. How do organizations become an IHP? Let's get started. In 2008, Minnesota passed healthcare legislation to improve the overall health of Minnesota citizens. Building on these reforms, the 2010 legislature mandated that the Department of Human Services develop and implement new ways to pay for healthcare, including accountable care organizations, or ACOs. ACOs are groups of doctors, hospitals, and healthcare providers who come together voluntarily to give coordinated and high-quality care to patients. With this project, Minnesota is one of a growing number of states to implement an ACO model in its Medicaid program. Provider systems or provider collaboratives can join the IHP program through an application process. If a healthcare entity becomes an IHP, it enters into a contract with the state of Minnesota. Under this contract, the IHP is eligible for a shared savings payment if they are able to reduce the total cost of care for their patients without compromising quality. Delivery systems are measured against targets for cost and quality. The IHP's targets are based on the Medicaid patients who sought most of their primary care within the IHP. In the first year of participation, delivery systems can share in savings. After the first year, they may also share the risk for losses. IHPs receive access to a data portal that contains ready-made reports on key metrics and access to data files that include all services for an IHP's patients. IHPs receive technical assistance, resources, and opportunities, such as quarterly meetings to discuss the use of data, share best practices, discuss challenges, generate new ideas, or develop new partnerships. What are the goals of the IHP demonstration? IHPs seek to move Minnesota's healthcare systems toward achieving the goals of the triple aim of healthcare. These goals include improving the patient experience of care, improving the health of populations, and reducing the cost of healthcare. The Department of Human Services recognizes that no two patients are alike and no two healthcare systems are alike. Therefore, the IHP arrangement guides the what, better care and lower costs, rather than the how. The IHP arrangement provides opportunities for broad and flexible innovation under a common framework of accountability. By focusing on the total cost of care for most core services, the IHP demonstration drives incentives away from doing less, but towards greater integration and efficiency. Having one health system be responsible for the total cost of care also encourages accountability for the care of the whole patient. Robust and consistent quality measures also encourages participating health systems to lower costs, but not compromise quality. The IHP does not place additional burdens on the system, but encourages practices that should already be happening in a high-quality, holistically focused health system. Now let's talk about the different types of IHPs. IHPs may be virtual or integrated. These differences have to do with the structure and capacity of delivery systems and has implications on the level of financial risk that an IHP takes on. The integrated IHP model applies to delivery systems that provide the full spectrum of care as a single entity. It usually includes a hospital and serve greater than 2,000 attributed individuals. Integrated IHPs take on upside risk in the first year of their contract, meaning they only achieve savings and do not incur any losses. However, in the second and third years, IHPs must take responsibility for a portion of the losses if they do not meet their targeted total cost of care. The virtual IHP model may include a number of different provider types. For example, it could include independent physician clinics or a group of health systems working together as a single IHP. It also includes any small systems that have less than 2,000 attributed individuals. Virtual IHPs only take on upside risk. Throughout the state of Minnesota, there are currently 19 IHPs serving over 340,000 patients in both rural and metropolitan settings. Each IHP has its own unique strengths and unique population needs. The first round of IHPs began in January 2013. Since that time, more systems have joined or renewed their participation in the IHP program each year. So far, the IHP program has seen great success. In the first 3 years, providers have saved over $150 million while maintaining or improving quality. Some examples of strategies that IHPs have employed include care coordination, creation of multidisciplinary care teams, greater data integration, real-time identification of patients admitted to the hospital or emergency room, developing new community partnerships, and focusing on the highest cost patients. The Department of Human Services is continually looking for new ways to partner, expand, and improve the IHP program in order to better serve Minnesotans and move us all towards better health at lower costs. To be eligible to become an IHP, applicants must meet the following requirements. 1. Deliver the full scope of primary care services. 2. Coordinate with specialty providers and hospitals. 3. Demonstrate how they will partner with community organizations, social service agencies, and integrate services into care delivery. In the spring of each year, the Department of Human Services releases a Request for Proposal, or RFP, for healthcare delivery systems to apply to become an IHP. During the RFP period, prospective IHPs can schedule meetings with the state to discuss their ideas and get their questions answered. Frequently asked questions will be posted online. IHP applications are due late in the summer. The state will review the proposals and begin reaching out to prospective IHPs. Provider lists submitted with the proposal allow DHS to prepare preliminary exhibits that can help the IHP understand what to expect in terms of their attribution, cost, and risk. These exhibits can also be used in the follow-up discussions. By the end of the calendar year, prospective IHPs should have a signed contract with the state of Minnesota's Department of Human Services. In January of the following year, the prospective organization will officially be an IHP. With minimal additional administrative burdens, participation in an IHP provides supports and a financial incentive that can help your organization improve the quality of care and provide increasingly more holistic care for patients. The shared savings allows your organization to get credit for the quality care you are already providing or improvements you are already making. So whether you're interested in becoming an IHP or just curious about the project, we hope that this video was informative and answered some of the questions you may have about IHPs. Thank you for your support as Minnesota strives to achieve better health care at lower costs for our state. For more information, please click the link below.